Many women experience painful periods and think it is normal. But what if this pain is a sign of something more serious? Hello everyone, I am Beatrice. In this video, we will explore endometriosis. So look at what it is, the causes, the stages of endometriosis, the signs and symptoms, how to diagnose it, including treatment and management. And we'll also discuss what to do if a woman wants to conceive with endometriosis. And also we'll make a little comparison between endometriosis and PCOS. So let's get started. Endometriosis is a chronic condition where tissue similar to the one that lines the uterus grows outside the uterus. We know that endometrium is the inner lining of the uterus that responds to hormonal changes, especially estrogen in the follicular phase. So during that follicular phase, this endometrium thickens in preparation for fertilization. And if fertilization does not occur, yet the woman has ovulated, both the egg that was not fertilized, which now convert to corpus luteum, together with the endometrial lining that was once thickened, it breaks down and is shed up together as menstruation. So the same way, this misplaced tissue that look like endometrium, that cannot be found, at times it can be found around the ovaries, the fallopian tubes, the intestine, the pelvic wall, even on the bladder. It can begin to also respond just the way endometrium responds. So in other words, it thickens, it breaks down and bleed with menstrual cycle. But because this blood that is not being shed off as menstruation have nowhere to go because it's not from the uterus. If it is in the uterus, it will shed off and pass through the cervix down to the vagina and it is passed out. But because it's attached to other part of the woman reproductive system where it's not able to exit the body, it can lead to inflammation, scarring, and even sometimes infertility. Now let's look at the causes of endometriosis. So what could cause this condition? Well, the exact cause of endometriosis is unclear, but several theories attempt to explain how it develops. The first one is retrograde menstruation. So what this one is saying is that menstrual blood flows backwards into the pelvis, and as it's flowing back, it's carrying endometrial cells which can begin to grow. The next one is surgical scar implantation. So what this one is saying is that endometrial cells attaches to surgical sites after procedures like cesarean section. Then we have lymphatic or blood spread. So this one is saying the endometrial cells can be carried by lymph or blood and it can spread down and begin to grow somewhere else. Then we have immune and hormonal imbalance. So this is saying that with weak immune system and high estrogen, it can allow abnormal tissue to survive and begin to grow. And finally, genetic factors. So family history can increase the risk of developing endometriosis. Now let's look at the risk factors for developing endometriosis. The first one is early menarche. So when a girl starts menstruation too early, that means this lady will be exposed to estrogen for a very long time. It can put the lady at risk of developing endometriosis. We have short menstrual cycle. The usual menstrual cycle is between 21 days to 35 days, with an average of 28 days cycle. So anything less than 21 days can put a woman at risk of developing this condition. And then heavy periods, even prolonged period. So if a woman menstruates for more than 7 days and is so heavy, the woman is at risk of developing endometriosis. And then we have nulliparity. So for women that have never conceived before, they have aged, they've been trying to conceive but it's not happening, they are at risk of developing endometriosis. And then we have family history. So genetic plays a role. Especially your maybe sister ever had endometriosis or your parents, it can put you at risk of that same condition. And finally, high estrogen. So estrogen is a major hormone that is responsible for thickening the endometrial lining. So if a woman has so much of this high estrogen, it can put the woman at risk of endometriosis. Now for the stages of endometriosis, because this can determine how severe the symptoms may present, there are 4 stages. We have stage 1, which is minimal. So this one, they are just small and few lesions. Now for stage 2, which is mild, there are more lesions with deeper implants. In stage 3, which is the moderate stage, there are deep implants with small ovarian cysts. And then for stage 4, that's the severe stage. So there will be a lot of large cysts, lots of adhesions, and lots of scarring. For the signs and symptoms of endometriosis, we have dysmenorrhea, that's painful menstruation. So this will be very, very painful. And then there is painful intercourse too. So when a woman has endometriosis, the woman may complain of pain during sex or even after sex. And then menorrhagia, heavy menstrual bleeding, very heavy menstrual bleeding. And then pelvic pain. Also, there will be painful urination. When the woman tries to urinate, she feels pain, yet it's not infection. And also there will be painful bowel movement. So she feels pain when she tries to urinate. She also feels pain when she tries to, defecate. And finally, infertility is another problem. Because of those scarring, it can block the fallopian tubes. It can just lead to naturally the woman may not be able to conceive. Now let's look at the diagnosis of endometriosis. So the first one, of course, is history and physical examination. Then ultrasound scan or MRI may identify ovarian cyst. But the gold standard for diagnosing endometriosis is laparoscopy. So it's a definitive diagnosis because it will allow direct visualization and also biopsy of those endometrial lesions. Before we look at the treatment and management of endometriosis, let's quickly look at the comparison between PCOS and endometriosis because they are different conditions, even if they both lead to similar problems like infertility. So the first one is the root cause. For the root cause, we know that for endometriosis is due to misplaced endometrial tissues. But for PCOS, it's more of metabolic and hormonal disorder where the ovaries tend to release more androgens, thereby failing to release egg regularly, and that will lead to formation of multiple cysts in the ovaries. For menstrual pattern, endometriosis can lead to very heavy and painful period. But for PCOS, it's either irregular or even absent menstruation. For the pain, endometriosis causes severe pelvic pain that can occur before or during menstrual periods, also even during sexual intercourse, during bowel or bladder movement. But for PCOS, pain is not the major issue. What happens more is more of discomfort and bloating from enlarged ovaries. And finally, for fertility impact, endometriosis can lead to infertility from scarring and blocked fallopian tubes. But for PCOS, the infertility is as a result of an ovulation where the woman does not even ovulate at all. Now let's look at the treatment of endometriosis. Now the first thing is pain management. To manage endometriosis, because we know it causes severe pelvic pain, we use things like NSAIDs, like naproxen or even ibuprofen. So this non-steroidal anti-inflammatory drug can be very helpful in managing the pain. Now also depending on the goal of treatment, if the woman wants to conceive, we'll look at different options. But if the woman does not want to conceive again, there are other options that can be used to manage it. So one of them is hormonal therapy. They can place the woman on oral contraceptive to regulate hormone and reduce bleeding. The woman can be placed on progestin like Depo-Provera to shrink endometrial tissues. Then we have gonadotropin releasing hormone agonist. This one can be given to induce temporary menopause. Now, if any woman is on hormonal therapy, we need to educate them of possible side effects like mood swing, hot flushes, even bone loss. So we also encourage them to take vitamin D and calcium. But if the woman wants to conceive, we try to avoid hormone suppressing medication. So we use other alternatives. One of them is laparoscopic surgery to remove some of those endometrial lesions. And then we have ovulation induction. They can give clomiphene to stimulate multiple ovulation where the woman releases multiple eggs and increase the chance of conception. And finally, assisted reproductive techniques like IUI, which is intrauterine insemination, or IVF, which is in vitro fertilization, can be utilized to bypass all those scarring and blocked fallopian tubes and help the woman conceive. And then we have natural and lifestyle management. This one is helpful to reduce those inflammation and also boost fertility, balance the hormones. Now, one of them is diet. So diet high in leafy greens. You can take berries, salmons, and other things like turmeric. They help to naturally reduce inflammation. And then I wrote here in red, if you're trying to conceive, try to avoid red meats, processed food, caffeine, sugar. They are not good for someone that have endometriosis and is already having fertility issues. So you want to try as much as possible to boost your hormones, to make it balanced, to boost fertility, to reduce inflammation. So some of these things highlighted there will not help you. And then we know the importance of exercise. It can naturally improve circulation, even reduce estrogen naturally. Then stress management. And finally, there are some supplements like CoQ10. It can help boost egg quality. So there are other vitamins that can help naturally, like vitamin E, that can help in nourishing those eggs and make you more fertile. So that wraps us today's topic on endometriosis. If you find this video useful, please like, share, leave your comment, and subscribe for more educational videos. Thanks for watching.